Hi everyone, my name is Artur Kurasiński, and for over 10 years I've been observing and explaining how technology influences us, people, and society. I'm greeting you from the studio inside the Innovation Campus, Warsaw in Poland. The podcast series called Early Adopters Nook, where we invite innovative startups to talk about their product and how it's changing the world. My today's guest is Tomasz Hipsz, CEO from Diagu. Hi, Tomasz.
Hi.
How are you?
Nice to meet you.
And my first question is, what is Diagu and what you guys do?
Diago is an AI-powered test analysis that gives doctors like a rich context that they need to quickly make more accurate diagnosis of the patients.
Mm-hmm. Okay. Do you guys have employees from medical background in your startup?
Yes. So we are working with clinicians, with medical entities, so with laboratories, with hospitals, with clinics, because AI is not just a system; it has to be based on like a real world data. Yeah, on every step of the process, we are working with healthcare professionals.
Mm-hmm. And you provide faster and more accurate diagnosis. How more accurate are these diagnoses?
Based on almost 9 million laboratory test results and diagnosis, we achieved like 97% success rate.
Oh my God, that's huge.
Yes, we have like several diseases that we can identify, and we are working with professors, with doctors, with diagnostic professionals. Mm-hmm. So they start with like describing what we can get from test results, what the test results mean, and then we move the data through our system. Then they analyze again. Mm-hmm. They say which way we should go, if it's the right way, if the results are okay, and then we compare the data with of the current results with all the results that we have in our database, and we run like a cycles through the system to increase efficiency and efficacy.
All right, that's pretty impressive. So actually, you said 90-70% of accuracy. It means that we can very boldly say that you guys have almost 100%, because this difference is very small. So is it right? Because right now, being a doctor, a person with the medical background, you are still a human. You can make errors. You sometimes you're tired. Sometimes you don't have enough data and even knowledge. Your system can tell with the 90-70% of accuracy. So it's actually better than human.
In some cases, it is. Of course, it still requires a lot of testing, a lot of development and research, but it's also effective because in different hospitals, different specialists analyze results a little differently. So thanks to the information that we have from many like healthcare centers and healthcare professionals, we can compare this data, and especially it is important for non-specialist clinicians, or the clinicians that are specializing in different area, because sometimes every specialist focus on their own area.
Sure.
So sometimes they miss some things, or they don't notice because there is a lot of information. Mm-hmm. So we focus their attention on the abnormalities or the different diagnoses, or sometimes rare diseases.
Mm-hmm. Well, that's very interesting. You said very rare and very diseases. So is it like in the future, like doctors will be like operators of the AI? Because there is no way one person can learn all the stuff, have all the knowledge from human history. So actually, this is something that may scary some people, but in my opinion, it is natural and very logical kind of step in the future, because there's practically impossible to accumulate all the knowledge.
Yeah.
So people will be like sidekick for AI.
I don't think so. I think I think we work with Microsoft and we try to operate under the principles of responsible AI. This system doesn't make decisions. It only helps and supports clinician to make the right decision, to give him more information, because at this stage AI don't have enough information, and it operates in the different way than human brain. And clinicians working with patients have many more information in some areas, but sometimes there is too much information from like other systems.
Yeah.
It's hard to find, hard to compare. So this way, through such system, it can get access to different sources of information, of data, compare them, and provide clinician like a report with a very concise way that he can use this data to make the right decisions.
So people will be still responsible and will be like key leaders in this process, and AI will be like very interactive, living, breathing database of the knowledge of the diseases and etc. Okay, yeah, of course. So
it's like you are supported by
Yeah.
many other clinicians and many other like cases.
Exactly. I'm gonna ask you about something delicate, because the data about our health has tremendous value to companies that teach their AI, because this is the way you learn. I mean, like, you teach your AI. You have to accumulate lots of data and then throw into this system. So why should hospitals and medical entities give you such sensitive information? What's the goal for them?
Well, the goal is to to use this information properly. The most important thing for us is data security and anonymization, because we use anonymized data. We don't need to see patients' name,
PESO.
address or anything else.
Okay.
We just use this anonymized data, and only place that they can be connected with this sensitive information is within like the authorized system, so within the hospital information system or laboratory management systems or within the clinic. So we just have the access to information that is anonymized. So there is no problem with the
privacy.
With the privacy. So because for AI it doesn't matter what you are called. We use only the information that is important, like age, gender.
Okay. White, Caucasian, 45, diagnosed.
And of course, we are now adding a lot more information from patients' records from the hospitals, but without this sensitive information.
Okay.
Just about like the information that matters about their condition and their treatment.
Okay, so when you have this data and you have all the information connected to the data, are you able to predict the onset of the disease based on the historical data? I mean, can you just say by looking in these files that one person in the near future will be sick and the disease will be exactly this?
It's more about current condition, and we compare it with historical data about the patient, and we show the clinician how the different parameters changed over time. But it is not like we predict that there will be more prone to some kind of disease in future. We analyze current state and like also based on previous results. So this is what is currently going on. So we suggest clinician what's wrong, what can all these parameters, what disease may be that there may be for this patient. So the clinician has to analyze all this information and see if it's proper and take next steps. For example, additional diagnostics or like improve treatment or impose treatment.
Okay, but I would say it's very tempting to be able to make such predictions. So there are several sci-fi movies showing a rather grim future in which algorithms assign roles to people knowing that person is going to have alignment or not, never, or you can get a job or insurance. And of course, this is, like I said, this is sci-fi. This is not something that we are going to see in the near future. But when you have data, when you have very well-trained algorithm, it is kind of,
Tempting.
very tempting. You can think of it as a, kind of crystal ball telling you exactly if my child is going to be sick because, my grandfather has this kind of disease in the past. So, this is like probability. This is like mathematics. This is like the operating on a big data. But is it possible to? I'm asking you, and I'm not trying to push the agenda that is able. You are able, capable to do it right now. But do you think, from your experience, is it possible in the future to?
I think in some cases it will be possible, but it requires a lot more information that we currently have. And in fact, at this point, I don't think that anyone can predict for sure, for example, that there are some kind of there are more risks for this disease or something, but it's also require a lot more information like genetics, etc. So no one has this information, no one testing, no one. It's not common to test, for example, to do the genetic testing for children and how it is, what's going on then and through the longer periods of time. But I think it will be possible in some way, but it's long in the future.
Okay, so particular diseases in particular cases, it's not something that's going to be common. Okay, I think it's, this is very relieving kind of information because we are afraid of technology right now. We don't know how this, computers, cell phones, or how it works. So, the state of current science is very kind of scaring for massive people. So that's why I'm asking
it's also
this question.
an ethical thing.
Of course.
Because, for example, when you are even now, in some cases, you can test children, for example, if they will be good in some kind of sports. But it doesn't mean that you will. You have more. For example, you have more effective muscles or you are more flexible or based on your genetics, but it's complicated and it is for ethical consideration.
Yeah,
because
sure. Well, I think I was asking the question myself when my wife was pregnant, how much money I will be able to, let's say, invest or give to someone if during the normal kind of test during this pregnancy, the doctor will tell me that my child is sick with something rare disease, but it costs only 100,000 zloty to remove this kind of gene, right? To edit the gene, and and the problem will be solved. Or for example, we can, let's say, program our child before it's created. For example, because we will be very pleased to have very talented kind of musician, or
or blue eyes,
or etc., or singing very beautiful. And of course, it is something scary because people are dreaming about this kind of abilities for millenniums. But right now, it's going more and more to be, let's say, you can say, this is possible in the future, 20, 40 years ago, it was like, well, this is completely, complete sci-fi. Right now, okay, this is like information. We don't have enough data, like you said, but it's going to be a more, let's say, the not maybe real, but let's say we have the stuff. I mean, like the pool of information. We have tools, and one day someone will, make something on it. And I think this day is coming. It's not something very, very far away.
So we have a different approach. We think that at this stage, AI can organize and analyze many more information and much more data than human brain, especially when clinicians are very sometimes working under pressure, or they don't have enough time to work with patients. For example, GPs in UK, sometimes they have only a few minutes for a patient, so it's not enough time to analyze all the data that they can get, in fact. For example, for allergies, there can be hundreds of different allergens to be tested. So it's hard to go through all this information, and AI can, machines can analyze this data, and AI can learn what to expect from this, and how to connect different parameters. That what can they show, for example, and they can analyze immediately a lot more than we can.
Of course. How do hospitals, partners, and physicians relate to your services? Do they view them as something positive, or more like competition? Do people they feel like, okay, this helped me in my job during my normal work day, or is it something that will replace me in the future?
They are very optimistic. They are a little afraid to share the data, but when we show that it is all anonymized, there is no danger of getting this sensitive information. Specialists, they have sometimes a little hesitation, but when they see what we do and how we can help them, they are also very optimistic. Of course, the implementation of such system is complicated. It's not just about technology, but also changing pathways of people that are working every day in the same, every patient with the same way, or to analyze data and so on. So using something completely new and that shows something different, it's different. And also it's they are afraid that, like you said, that maybe we want to replace them, but it's completely not the way we want. It's just to support them, to give them more information in a concise way. So when they understand what it does, they are very optimistic, and they say that it can be very attractive for them, and because we want this system to help clinicians to save time, to focus more on patients and on the case, not on the papers, documents, or clicking on the screen, because some systems now require a lot of searching, clicking to analyze all this data, to go into several pages of information. We want to organize this information, analyze it, and show the prediction, and support clinicians to make a diagnosis. And they, in a moment, they can go to the exact results and see by themselves what they want, what they need to see, and it's for them to analyze it after and to make decisions.
Okay. Do you think that your system or maybe some kind of very similar kind of system in the future can be communicated with via voice? I mean, do you imagine that we the doctor is sitting in a just one room, and it's talking to the machine like, okay, show me the data of this patient 1.89. Okay, what do you suggest we can, treat this disease with? Okay, so you give me 2 options, and I go with option number 1. Okay, so what will be the results if we will add something new like medication? Do you think this is like the way?
we were testing the system, and we are trying to make the system optimized for every specialty and for requirements of like every hospital, because there are different ways of doing things. So we try to make our system very elastic, flexible, and we can add our tool to their current systems, but also these additional gadgets that you can say, for example, the name of the patients, or even we can use other methods of authentication or identification of the patients, that you go to the patient's bed and you see, or you don't have to do anything and you just see the patient information. And you can. We want this system to be used during the work with patients. So at the patient's bed or during the consultation. So we are implementing like small tools to improve the user interface, in fact,
and experience.
To save their time, because every such thing saves their time, and to allow them to work the way they want.
No, they have to. The bureaucracy, the inputting the information, lots of time is consumed by the simple, filling the paper, blah, blah, blah. And I understand, because this is...
And a lot of these works can be automated.
Sure. That's what I was asking about the voice controlling, because for me, it's kind of very natural process when you're sitting and you're just, talking, and at the end you're saying, okay, so send these files to my colleagues and sign it, and, just put it in the big archive. And that's it. You don't have to manually, make, just sign the paper, push the button to print it, and then, stack it and put it in your cupboard. So yeah, I think the voice is, for sure, is very natural kind of communication for people. We are born with it. We are very skillful, because from very young age, we are using it very natural, and we know how to operate. We don't know what kind of language used to communicate with the Windows, iOS, etc., because they are like machines. And when you can be able to talk to machine, and a machine may understand and talk back, that's the magic happens. So is AI the answer to all our problems? I mean, is it really the big magical kind of entity that it's sitting in consuming, learning from data, and then boom, you can solve every problem in this world using AI?
No, of course not. It is just as a support tool for clinicians. So this is, we don't mean it to make decisions. So it's just, it can work as well as the data, as good as the data is provided. So if the data is not complete, or there is lack of some information, or the data is not precise, the system also won't be as precise as it should. So I don't think it's a solution for everything. It's just a tool, one of the tools that can support clinician. Just to not to bother with technology or all this information. Just focus on the case, on the patient, and on the treatment.
All right. This is exactly what I'm thinking. But many people are very, let's say, hyped with the AI because it's something new, it's very shiny. A lot of people don't understand that just AI you're talking is like been existing for years, but it's have different kind of names. But right now, for the startups and VC market, this is very this is very natural to label everything with the AI because everyone is, oh, you guys, you've done something remarkable with your AI, and this wall, you're building the next Skynet, right? And actually, it's a kind of few lines of code, and that's it, right? But we want to know, we want to understand, and want to see it as an AI. So, what are your plans for the next 12 months as a company, as a Diagu?
We want to continue collaboration with clinicians, with medical entities in Poland, US, UK, and implement our system to connect the system with their infrastructure. So we want to also to further develop this learning algorithms. We want to increase accuracy and the number of diseases that we can identify. We want to increase the data that goes through the system, because every time something goes through the system, it helps it to learn. And we want to expand our medical board with all the international clinicians and doctors, professors, and the people that know the most about this. And we want the system to learn from them.
Okay. Do you guys looking for an investor?
Yes, we are at the moment looking for investors. We have some investors that are to have conversations with, and but unfortunately it all requires money, and so we are looking for investors, but also for medical specialists, for partners like hospitals, clinics, laboratories. So we want to reach them. We are already working with several hospitals and laboratories, and of course specialists. And so we want to. We have commercial agreements also. So because it's our system, it's the AI is like a core, but we have all these tools that can help clinicians in a moment. So we are working also on this.
Okay. My last question: are there any differences between the European kind of legislation and hospitals and, for example, US? Because I think that US is based more on, the US law, American law is based more on the privacy issues are not so much, problems anymore. Of course, in Europe you have this GDPR, etc. But in the States you can probably buy everything you want. The data, the information. So, judging by your experience, do you think this is true, or just this is my assumption? It's not.
Yes, there are some differences, but every healthcare market is different. So this is the thing that we are focusing on.
Okay.
Not just legalities, but also how the system works. Whereas if the data is within few systems or many systems, or how they are the data is shared, how it is used in hospitals or by clinicians, because it's every market is very different. So we are trying to fit into the different
to
markets.
Understand and to learn.
We want to be one tool for all. We want to this core system is this analysis, so it works everywhere, because the diseases that are the same, and there is the same people. But how you use it within this healthcare market or healthcare environment, it's very different in different countries. So we are working in different approaches in different countries.
Awesome. Okay, thank you very much, Tomasz. everyone. Today's guest was Tomasz Hipsz, CEO of Diagu. Once again, my name is Artur Kurasiński, and this is podcast about early adopters, technology, and change. Please like, share, leave a comment below. This will help us to get to broader audience. Thank you very much, Tomasz.
Thank you very much.
And good luck. And hey, guys, see you next time.
Wow. Stop. What?